Blood clots on the legs and the lungs are a relatively common cause of hospitalization. When they affect the lungs, we call them pulmonary embolism, and when they're large enough, they can become life-threatening. Many of these blood clots are unprovoked. We find actually no reason for this event to have happened. Sleep apnea remains one of the least recognized modifiable risk factors for venous thrombosis, so for forming clots on your system. I am Dr. Jose Fernando Ramirez, a pulmonary critical care and sleep board-certified physician, and I'm going to show solid medical evidence linking sleep apnea with the risk of thrombosis. For clots to form, there are usually three main events that I'm showing in this graph. The first one is venostasis, the second one is hypercoagulability, and the third one is endothelial dysfunction. During sleep apnea, there's a phenomenon called intermittent hypoxia. So as your upper airway closes during sleep, you're deprived from oxygen, and oxygen is going to drop intermittently to very significant levels. That intermittent hypoxia contributes to hypercoagulability by promoting the turning on of procoagulant factors, clotting proteins that are designed to promote clot formation. And then some substances that are supposed to suppress that body ability to dissolve clots is also affected. So that is a really bad combination. And then you throw platelet dysfunction. Platelets are those small cells that rush to patch when you get a cut to stop the bleeding. Platelets become larger, become sticky, and become hyperreactive. So that will be factor number one. Factor number two is endothelial dysfunction. The endothelium is the lining of the blood vessels, the internal lining of the blood vessels. It should be, to put it in simple words, smooth. With sleep apnea, there is systemic inflammation. There is increase of inflammatory mediators that are going to make that endothelium more sticky. This is the list of those factors if you want to dive into more detail. And then on top of that, the way blood returns into the left side of the heart from the venous system might be affected because of intrathoracic pressure shifting. That affects the way the blood returns. And then you have this triad. The medical term is the Virchow triad. And all of those are hit by sleep apnea. And this is not just theory. There is very, very compelling worldwide data from large studies. This is a list of some of them. They basically, in summary, describe how sleep apnea can double or triple the risk of venous thromboembolism. And those in the medical community with medical knowledge, I invite them to dive in these studies. They will be listed at the end of the video under the comment section. And at a graphic level, this is the way a clot looks. Simple occlusion of a blood vessel. It can dislodge. Usually it forms on the veins, on the legs, and then it travels to your lungs. And unfortunately, this is just a graph. But in my practice, this is the reality. This is a CT scan of a young patient that came to the hospital with sudden onset shortness of breath, chest pain, low oxygen, and low blood pressure. He had sustained a pretty serious pulmonary embolism. In this case, I'm showing the ways occluding the right main pulmonary artery. This is going to create a very serious overload on the right side of the heart. And the right side of the heart is a low pressure system. It is not designed to sustain this type of pressure. That can potentially lead to a state of shock. Now, as a disclaimer, I have managed a few thousand patients with sleep apnea, and most of them do not develop this type of events. The severity of the sleep apnea, the hypoxic burden, how much oxygen you lose with these events, perhaps is a more significant factor. But I have also found patients, sometimes young patients, that had absolutely no other risk factor for pulmonary embolism than sleep apnea that was not diagnosed previously. So why do we face this situation? Why a condition that is so common, that is so prevalent? In the US alone, 30 million plus patients with sleep apnea, and we diagnose less than 10%. And worldwide, there's about 1 billion people with sleep apnea. Those are the estimates. And I think it stems from two main problems: lack of public awareness about this condition, and there's also a problem with medical education. And very respectfully, I'm going to say this. I have had the privilege of mentoring very bright physicians from across the world, except Australia. I have not trained anybody from Australia, but I have trained physicians from, of course, US graduates, Central and South America, Asia, Africa, Europe. And I always do the exercise of asking them how much the medical school spend teaching you about sleep disorders. And what I have found is about 2 to 3 hours through the entire medical career. And you might come from a university where things are different, but that's what I have found. And I say it very respectfully. It is important then to increase public awareness and to train our doctors better in these aspects. Symptoms of sleep apnea are overlooked, but things for you to remember: if you're snoring, if you wake up fatigued or tired, if you feel sleepy during the day, if you wake up to urinate at night, or if your partner, boyfriend, girlfriend, wife, spouse is telling you that you're choking during sleep, then you really please pay attention, because you might be suffering from sleep apnea. And if you do, then talk to your doctor. He will determine if you're a candidate for a sleep study and which type of sleep study you should have. In my practice, most patients are diagnosed with home sleep testing that these days is extremely precise, extremely accurate, and simplified things tremendously. And about treatment, so we have been using treatments, as I mentioned. We have been managing apnea for about 40 years. And CPAP, which is the gold standard, remains king because it's very effective. I'm a CPAP user myself. I have had my share of difficulties with it. I will devote a whole video to speak about sleep apnea, my journey. But I encourage you to drop, misconceptions about using CPAP. I have had young patients with very successful stories using CPAP therapy. Then there are dentists that manage apnea with a special mouth guard, and then there are surgical procedures. But this is for you and your doctor to determine which route you should take. If you enjoyed this video, like and subscribe and share it. You might be saving somebody's life if you do.